Welcome back to the chat on Newsday Amarillo and News Channel 10-2. Our good friend, Dr. Lance Izumi, joins us this morning. Dr. Izumi, welcome to the show. How are you doing today?
Well, I'm doing great, David. Great to be here. Happy early Easter greetings to your listeners and to your viewers.
Well, Doctor, we've talked about this a ton since we've known and met you, and we talk about what happened to the educational system during the pandemic and how it's going to be affected and the effects that's carrying on. And now we just saw an article recently in the New York Times, and this has been discussed before. Maybe we approached this problem the wrong way, especially when it came to children and education with the pandemic. Some schools closed almost 2 years. The system was just disrupted, and we see the ramifications. We see the hard adjustments in society, the educational difficulties that have this brought on. Tell us a little bit more about the article and what the findings are.
Well, this is a really important article by the New York Times. I mean, it's almost like a mea culpa admission of, that they were wrong from the beginning. Is that what they said was that the school closures, which, as you mentioned, in many places lasted for 2 years, didn't stop the spread of COVID. That was the bottom line. Is that if you looked at the data coming out of the health studies that were done, that COVID actually wasn't really prevalent in the schools. And so, in fact, even when you had communities where you had large outbreaks of COVID, the schools actually had a much, much lower spread of COVID. In fact, the number of cases of COVID in many school districts where COVID was prevalent in the community was very microscopic. And what's interesting is that the COVID transmission really wasn't from child to child or child to adult. It was really from adults to children. Mm-hmm. And so, therefore, when you had a lot of the teachers' unions, for example, saying that, well, they didn't want to open the schools because there would be this great transmission of COVID from children to adults, the teachers and the staff. Well, actually, that wasn't the way COVID worked. It was actually the other way around. And so we really should have been opening the schools much, much sooner than we did. Now, one of the things that the New York Times indicates in their article is that the more time that students were in a lockdown situation where they were learning through remote and distance learning, the greater the drop in their student performance. And so, therefore, you saw, big drops in math and reading, and we're still living with those drop-offs today. And in fact, the test scores on the national tests here are at its lowest point in, decades, actually, right now. And I think is interesting, and again, the New York Times points this out, is that if you look at the kids who were in districts who were in schools that were closed longer, the learning loss for them was double than the amount of learning loss that you saw in schools that opened up quickly. So therefore, there was a big difference in how those students performed, depending on when they went back to in-person instruction. And so I think that's a huge point. And I think the other thing that we need to understand too, and kind of gets to the first thing I mentioned is that we knew a lot of this when the COVID really first started. It's not something that we're just learning in 2024. It's really the case that really only 2 or 3 months after COVID really hit, that we actually knew that we'd have these losses in learning, that we'd have, emotional and mental health issues that are suffered by our kids, that we would have all kinds of behavioral issues also going on. And so all of these things were recognized early on by all kinds of different studies, actually, by the Centers for Disease Control, university studies from abroad. That data was really available, certainly by the summer of 2020. And yet here we are in 2024, and the New York Times is, well, thankfully, better late than never, but at least is acknowledging that this happened. But one of the things that they mentioned in the article is that, well, we had the data, but, we didn't act on it because of fear.
Fear. Oh, wow. Letting the fear run you. That's always a problem.
One emotion. Well, do all those things that are involved in this, but let's talk about this learning deficit. Do we have any idea how long it will take some of these school districts and things, different areas of the country to catch up to, where we should be?
Well, Rhonda, that's a really important point. So here we are at this really low ebb when it comes to student achievement right now in the basic subjects. And unfortunately, if you look at some of the studies that are now coming out on, how long that learning loss will last, and the impact of that learning loss, some of that may never be gotten back by those kids. Unfortunately, if you look at studies that were done in the past when there have been these large learning losses due to various factors, that a chunk of that never does come back. Hopefully we can do things that will remediate these kids, but it's going to take a huge effort. One of the things that you're seeing now is in different states is that governors are pushing, maybe more tutorial services for kids who are having problems in, the basic subjects like reading and math, and that could have an impact. The problem though is, what kinds of methods are they going to use to teach those kids during those tutorial programs? If they're kind of doing what they had done before COVID, and the learning levels of the kids were not great before COVID, then I think that you're going to see, the continued stagnation in student performance. You really have to look at what works. There are things that work. There are states that have modeled those sorts of things, and we have to look at their models and not just recopy things from the past.
Mhm. Dr. Zume has a new book out. We're going to take a quick break. When we come back, we're going to talk about the great classroom collapse and what we can do or what you can do to combat it. We'll take this break. We'll be back with more chat on Newsday Amarillo and News Channel 10.